Every 40 seconds, someone in the U.S. has a stroke. 2/3 of stroke survivors are challenged with impaired function. Nearly half say arm movement is their most common physical challenge. What if there was a way to accelerate your patient's recovery? Well, now there is. Introducing Tailwind, a revolutionary new arm rehabilitation device.
My vision is for people who think that their arm is beyond improvement to recognize that there still is potential to change. And even if it's not back to independently writing and using fine motor abilities of the arm, that they can use it in a meaningful way.
Tailwind was developed to help improve arm mobility and range of motion in patients who have lost upper extremity function due to stroke or other brain injury. Dr. Sandy McCombe Waller and Dr. Jill Whitall are researchers at the University of Maryland at Baltimore who've been conducting tests for over a decade to perfect the Tailwind. Their studies show that patients who use Tailwind achieve greater motor cortex activation, leading to improved arm function.
We tried our best to put in the scientific principles that we thought would really maximize their gains.
Tailwind is a bilateral arm trainer with rhythmic auditory cueing, or batrack. It has two handles that move independently along resistance-free tracks. Patients move the handles towards an endpoint in response to auditory cues from a metronome. As the patient progresses, the endpoints are extended outward to increase reach. The tracks also adjust up and out to make the exercise more challenging.
I think for as simple in design as the device appears, it's very challenging for patients, and they really work to try to reach those targets and to keep up with the timer. So it's engaging and challenging for them.
The benefits of Tailwind are not dependent on age, gender, or time since stroke.
Hit the stop every time.
I was like so many other stroke survivors, that I thought that whatever I had achieved by month 4, I wasn't going to get much better, that I was going to plateau.
Jose started using the Tailwind as part of a clinical trial more than 3 years after his stroke at age 47. The improvement surprised him.
Well, I started seeing results within the first, I want to say, 2 to 3 days. It's improved my chest, it's improved the muscles on my back, and so my arm, that its tone, the muscles want to improve.
They quite quickly feel a sort of difference in strength, and they can tell that their muscles have been used, and they'll report that back to you.
Patients who use Tailwind communicate meaningful quality of life improvements, such as holding up a newspaper or getting out of the tub on their own. Many saw these changes in just a few short weeks. Norris, who started using the device 10 years after his stroke, says it has changed his life.
5 minutes that you just did, you've done over 200 repetitions.
Because of the Tailwind, he can now play catch with his grandson, work in his garden, and even play golf.
It's amazing.
Although the Tailwind is an ideal tool for clinical use, it was designed to be easy to use at home as well. In this way, Tailwind can provide its distinctive benefits even after discharge from therapy. This portability and ease of use is one of the things patients are most impressed with.
This thing is lightweight. You can take it home. You can set it up by yourself. And, then you could do what I like to do, which is to work out every day at my own time. So at the end of the day or in the morning, during lunch, while you're watching TV.
Tailwind has over a decade of scientific research trials with proven clinical outcomes. Its unique engineered design provides durability, a variety of challenging non-invasive exercises, ease of use, and portability. The Tailwind can be used independently, and it is easily incorporated into any stroke rehabilitation therapy treatment.
One use of the Tailwind in a facility is that, particularly if you're treating multiple patients at one time, you might be able to set some patients up getting the practice while you're working more individually with another patient, and then come back to the patient that's been practicing on the Tailwind and then work individually with them. So it could really improve your staff utilization and keeping people actively engaged in therapy versus sitting waiting while a therapist is co-treating another patient.
Tailwind backtrack scientific studies have been published in leading medical journals, including Stroke and the Journal of the American Medical Association.
In our study, we observed stroke survivors using bilateral repetitive movements on the Tailwind's device. These movements restored upper extremity function in stroke survivors. And for that reason, we recommend the use of the Tailwind device in selected stroke survivors with moderate and moderate to severe upper extremity impairment.
The Tailwind comes with a detailed manual and an instructional DVD. It doesn't need to be plugged in. Just put it on a table, open it up, and you're ready to start exercising.
I believe that this device can help improve the lives of stroke survivors and similar. And it really works, and I believe in it.
Tailwind is now available to rehabilitation facilities, therapists, and patients worldwide. For more information, go to www.encorepath.com or call 1-877-922-0053.